Okay, as a pharmacist, I gotta tell you, I get concerned when I get phone calls from patients that call them and say, "Hey, I found this in my medicine cabinet. I want to know if it's okay to take it." So, I got thinking for Rx Healthy Habits for our subscribers. I said, I should do a video about what you should have in your medicine cabinet and maybe what you shouldn't have in your medicine cabinet because I gotta tell you, that's probably just as important. I think I'm going to go through and talk about a few things here with you in the next few minutes about some do's and don'ts, but also what should be in there. So, first thing, let's talk about some do's and don'ts. Do go through your medicine cabinet once in a while and check the dates on everything, and whatever's expired, throw it out. Now, if it's a prescription medication, I got to tell you that usually the expiration date on that bottle is 1 year from the date we filled it. It might not necessarily be expired, but don't keep it too long. Eventually, 6 months or a year after that date, please get rid of it. And the other thing about taking prescription medications, a lot of times if you don't take antibiotics long enough and you just start out on them and only have a couple days, it's not going to do you any good, may do some harm. The other thing, here's a big do. Any over-the-counter medications, check the dates on those also, especially the creams and ointments that's at the bottom of the tube. Get rid of some of that stuff. If it's expired, don't keep it around, especially liquids. It's not going to do you any good. It'll be very less effective, and possibly sometimes, especially eye drops, eye ointments, they might be contaminated. They can only re-sterilize themselves so much. So do get rid of a lot of things. Here's some that you don't want to do. You do not want to keep prescription medications in your medicine cabinet, especially tablets and capsules, because the moisture is not going to be their friend. And secondarily, anything that's an opioid, a narcotic, anything that's a benzodiazepine, muscle relaxant, anything that's a controlled substance should not be in your medicine cabinet. I know you're going to say, well, I have people that come over that are trustworthy. That does not matter. If you have nephews, grandchildren, friends, visitors, first thing people do if they're seeking anything is go into the medicine cabinet. I know that sounds like, you trust the people that come in your house. I'm just telling you that opioid addiction starts many times with people that took not their own opioid medication, like for a dental procedure or for a post-surgery. It usually started by taking somebody else's opioid medications that were not prescribed for them. So, big thing. Real quick, there's so many areas to go through, but for headache, fever, and pain, I would have ibuprofen or non-steroidals like naproxen on hand, and I would also have acetaminophen or Tylenol. Both have some good uses. Some people prefer ibuprofen. I do. If you have bleeding disorders, not a good idea. And if you have history of GI bleeds, not a good idea to take ibuprofen. Acetaminophen is great. Don't exceed the 3,000 milligrams if you're over 65, and if you're over 18 to 55, you should not be taking more than 4,000. So pain relievers, gotta have them. Gotta have them for fever, gotta have them for aches, they're awesome. Next thing, huge, a thermometer. Gotta have one in your medicine cabinet, digital, because first question the doctor's gonna ask you when you call up and say, do you have a fever? And then a lot of times people say, yeah, it's a real high fever. And when you check it with your thermometer, it's only 101, which is still a fever. But here's my point, you gotta have a thermometer. Digital ones are cheap right now, they're very simple to use. They're great. For colds, anytime you have a cold, I would have some Dayquil and NyQuil. Sometimes I got the combination of the Dayquil and NyQuil, the daytime, nighttime medications. There's a lot of name brands out there. I mean, obviously when you go to the store, you can get the off-brand or the store brand. But there's so many medications out there for cough and cold. Match up the symptoms and keep some of those around. I think you should have a strict cough medications also in there, like Robitussin DM or Delsum. I know I'm throwing a lot of trade names, but there's also off-brands in the store. But those medications are good to have for coughs. For allergies, I have Benadryl on hand for allergic reactions, whether it be a bee sting, whether it be a drug reaction. But I have Benadryl on hand. But we also keep Zyrtec and Claritin on hand, non-drowsy seasonal allergy medication, which is excellent. So I think you should have some of those, and maybe some eye drops if you have seasonal allergies. And if you have nasal symptoms, for some fluticasone or some nasal sprays if you need them. Now, I'm not a big allergy sufferer, but my wife is, so she has all those things. For digestive problems, standard to have is, of course, an antacid, whether it be a Rolaids, Tums, or Liquid, Mylanta, Maalox, any off-brand of those. Have those in there for quick relief, but long-term relief, or maybe intermediate relief, you could get with Pepcid, Famotidine, some of those Tagamet, some of those medications. Watch the drug interactions though with Tagamet. But those are good to have for some acid buildup or acid trouble where you're having a lot of sour stomach. Also, Prilosec is good if you have ongoing heartburn. It usually works, it takes a little bit for it to work, so you got to give it several days. but I would have some of those in there. Laxatives, absolutely. If you're troubled with occasional constipation, you got to have a laxative in there. So itchy, rash, bug bites, irritation, skin irritations, hydrocortisone cream #1. Always have that on hand. You also may want to have some antihistamine cream for itching. I have calamine lotion when I used to work around and get poison ivy, but that's not an issue out here, but it could be where you live. I think you should have in your medicine cabinet some antiseptics like benzoyl peroxide. That's a good one to have. Maybe some betadine. When you get a cut, you always want to dress that. Those are definitely some things you want to have in your cabinet. If you have bandages and first aid stuff, that should all be maybe not necessarily in your cabinet, but close by so you can get to it. Antibiotic ointments, polysporin, neosporin, those are good to have. I also keep in my medicine cabinet, and then I'm going to wrap up with this. I have some things for dental pain, and usually my best friend is ibuprofen and acetaminophen, but you might want to have some topical things if you have some mouth sores, the result of dental pain or gum pain, just to have something to numb it till you see a doc. I have a eyeglass repair kit ready to go in case I need to do some tinkering. I like to have a pill cutter in there, and I also like to have a magnifying glass and tweezers for if I get some splinters. And if you live in the Northeast or areas where there's ticks, you may want to have a tick remover. Does that make sense? So anyway, in your medicine cabinet, great thing to have. Biggest mistake I've seen people make, again, is not going through once around, absolutely throwing out anything that's over the expiration date. And also what I see keeping in there is medications that really do not belong in there. So I hope that helps. And for more information, always stay tuned and jump on board on our email list so you can get rxhealthyhabits.com emails. They come out once a week on some topics. I think you're going to love them. So get that medicine cabinet checked out. Go through there and do some house cleaning in your medicine cabinet. Throw some of that stuff out and replace it with some new stuff. Okay? Until next video.